So here's a very cool case. There are 3 findings you need to identify, right? So remember that. 3 independent histologic diagnoses. The first is this. Remember, this is a redo joint. So one of the questions asked was, is this infection? And I'll just show you a couple of fields. Here's more. There are neutrophils in the fibrin, which obviously don't count. And then there are neutrophils in the tissue. I hope you can see them. Here's more neutrophils. Remember, they have to be outside fibrin and outside vessels to call it infection. So that's finding number 1. And you can see these neutrophils are diffusely distributed through this tissue. Finding number 2 is right here. I'm going to show this to you on high power. It may or may not project very well. I'll do my very best. It's this sort of blackish, brownish material. Let's give it one more shot. I realize it's hard to see, but there are some sort of, well, crystals in here. Interestingly enough, there are neutrophils around it, but there's no foreign body giant cell reaction. And finding number 3 is on this fragment here. It's this eosinophilic material. And I'll show you some more. Here you go, and the eosinophilic material is associated with this cracking artifact. 3 diagnoses, ladies and gentlemen. So diagnosis number 1 was very easy. There's sheets and sheets of neutrophils in here. Let me find them for you. There you go. And as I showed you earlier, there were even more neutrophils. This is infection, and the criteria for infection are listed here. Diagnosis number 2 is calcium pyrophosphate, and I don't know whether you can see these crystals that are deposited here. I know it's sort of fuzzy and hard to see, but these are calcium pyrophosphate crystals. And finally, remember that eosinophilic material right here with that cracking artifact, like right here, that, as you might have guessed, is amyloidosis. So 3 diagnoses.